we actually recover fully from depression?
Yes, there are people who can recover fully from depression. But it's important that you get treatment, appropriate treatment, early, depending on how you respond and how you are compliant with the medication.
This video is proudly sponsored by Sharks Hive. Are you worried about the rising rate of insecurity in the country? Then worry not, Sharks Hive has got you. Sharks Hive is running a CCTV camera promotion that will allow you to view your business or home even when you are not in the country. Their full package for 4 cameras costs only 2,500 Ghana cedis. Yes, only 2,500 Ghana cedis. And this is the 1-week promotion that they are running. You can reach Sharks Hive on 054-730-8302. 054-730-8302. Welcome guys to Daily News Hive again, where we bring you informative, educative and transformative content. Today, we are going to have a very exciting interview. We are going to talk about depression, we're going to talk about stress. A lot of people deal with these things these days, but especially in our part of the world, these things are not talked about that much. Mental health has a negative connotation, especially in Africa, people of African descent. So today, we're going to demystify stress, demystify depression. So don't forget to like and subscribe. Smash that like button. I'm talking to you. Smash that like button and click on the subscription. So anytime we release our content, you'll be one of the first people to get it. All right. So stay tuned for the rest. Okay, guys. So we're going to talk about depression. So we are here with a very wonderful person. I'm very excited about this interview. I've been waiting for it for weeks. Weeks.
I'm excited too.
All right. So can you introduce yourself to our viewers?
Okay, so I'm Dr. Lyanne Boateng, a resident in psychiatry at the Accra Psychiatric Hospital. And I'm also a serial entrepreneur. I have 2 companies, Bell Plus, which is a plus size fashion or clothing line for plus size women like myself. And then I have a startup school which helps train entrepreneurs, guide them to start their own businesses from scratch. Yeah.
That's amazing.
Yeah.
So we will get all into that, but now let's tackle the issue of mental health.
Okay.
Mental health is a very big problem. I know a lot of people who are going through depression, especially men, but they can't say anything about it. So that's why we are even doing this video. We want this video to be able to help people, and people can see the video and to address their mental health problems.
Okay.
So what is depression? How do you know if you are depressed? Because many people think depression is like sadness, but how do you know if you are just sad, or how do you know if you are depressed?
Okay, so as humans, we all have emotions, and it's okay to feel sad, to feel happy. You can't be happy all the time, you can't be sad all the time. However, when you are so sad continuously for more than 14 days or 2 weeks, then we will say that you are depressed. And even with that, there's a criteria for you to meet for us to say that, oh, this person is depressed. So aside from the sadness, you could have a decreased interest in things you used to do. Okay. So if you used to like playing football, all of a sudden you're not interested. You may have guilty feelings, things that didn't used to bother you. You are blaming yourself for things. Even maybe in the past, you may see that you have a decreased energy. So you used to be a very active person, a morning person. Now you're in bed all the time. You feel drained. You don't have energy for anything else. And you can also have decreased concentration. So you may be doing something, you see that you're so forgetful, like, where did I put my car key? It's happening so many times. Also, you may become slow, how you walk. People realize that there's something wrong with you. So if you have, and then there's also the sleep changes. Some people sleep a lot, and some people cannot sleep at all. So
it means that there's a link between sadness and depression.
Yes.
So if it's prolonged, you're saying 14
days.
14 days.
Yes.
Wow.
continuously for 14 days, then we'll say you are depressed.
But what about if you are sad and you're happy? It's a mixture of both, but for what happens, sometimes a lot of things happen during the day, especially if you're a business owner.
Okay.
Your day can be very happy, but the ends, maybe a customer says something that will just bore you.
Yeah.
And you become sad the whole night. But how do you know? Because how do you really know? Is there a test? Do you need to? Okay. Is there a time frame? So if I say if I'm sad for 5 hours a day, or if I'm sad for 4 hours a day,
okay,
how do I really know?
So the people who are really depressed notice they are sad throughout the day for 14 days or more. So you see that maybe in the whole month you realize you're always sad. You notice it yourself that you're actually sad. We all have our sad moments, but then when you meet the criteria, if you get 5 out of 8 of the things I spoke about, and then you notice that the sadness is more than 2 weeks, it's not just 2 hours, 3 hours, 4 hours, 5 hours, but it's continuous. They notice, as most of our clients notice, that no, I'm actually sad and I can't help it. Even when I'm happy, it's just for maybe an hour or two, then I go back to being sad. Or maybe I can watch a movie to go away, but then I'm back to sad. So baseline sadness for that 2 weeks duration.
Wow.
Yeah.
Then means what you're talking about, it requires a level of self-awareness.
Yes.
It means that you have to be able to know who you are. Then before you can compare it with how sad you are feeling, whether your sadness is unusual or not.
Yeah. And then there are different ways for us to. So when you come to us in the hospital, there are a lot of questionnaires we give to you for you to fill, for us to actually determine the level that you are, whether you are mildly depressed, severely depressed, or moderately depressed. And then that will guide our treatment. So you may notice, so when you notice like you're sad, you're crying, all this, like every day you have crying spells, things that you're not supposed to cry about, you're crying about it. And you know in Ghana we say that bear men sue, or men don't cry, but you notice that no, when you're alone you want to cry, then you can say you're depressed. Okay. So yeah.
So apart from sadness and sleep, are there any other symptoms or signs of depression?
So as I said earlier, you may feel guilty, the low energy levels, the slowness, the appetite changes. So some people eat a lot to try and make themselves feel better, and some people don't eat at all. They starve themselves. So it's the extreme ends. And then we can also have the decreased concentration, is like forgetfulness, and then the crying spells, and then the loss of interest is really important.
Loss of interest
in things that you used to do. It's called anhedonia, like things that used to
interest. Can you say the word again?
Anhedonia.
Anhedonia.
Yeah. Things that used to interest you, all of a sudden you are no longer interested in them.
Wow.
Yeah. So
maybe if you used to like going out to people, now you just want to be by yourself.
Exactly.
It means there's a possibility you are ending up in depression.
Yeah.
Because I used to know a lady who was doing her PhD, but she had issues with her lecturers.
Okay.
After some time, she just recalled, she was in a room by herself. And later, before we realized, she was just diagnosed with depression.
Yeah.
And we were surprised. So it means that that's a very, very big sign. Loss of interest.
Yes, loss of interest.
Wow. So let's change the topic a bit.
Okay.
Are people born with are there people who are born with depression, like they inherited it from their parents? Is it hereditary?
Okay, so genetically, when you have a first relative, so let me say your mom, your dad, or your siblings, if any of them has depression, you have about 20 to 30% chance of also getting depressed.
Wow.
Yes. So it's genetically, there are some genes that have been seen to be associated with depression. And more so to the environment really kind of affects you. And then also there are some things that you may go through. So if someone loses their parent before the age of 10 years, it's likely they'll grow up to be depressed at a point in time.
Wow.
Exactly. So then your environment, stresses in the environment, like you've lost your job, or you're not happy in your work environment, or then a relationship has gone wrong, you don't have social support, finances are bad, they can all tip you into depression.
Wow.
And also if you are diagnosed with maybe cancer, chronic diseases, like maybe you become diabetic, they've cut your leg, they've amputated your foot, kidney failure, all those things, you tend to think about it it stresses you out, and then you become depressed.
Well, that means COVID would have probably increased depression cases.
Yes, we've seen a lot of cases, because then COVID came with social isolation. You're not supposed to go out. Then we have these lockdown restrictions, so people are not getting to do things that they used to do. Maybe someone really likes to go out, play basketball, be with their friends, and now because of COVID you can't do that. So then we've seen a high number of cases with depression, especially within this COVID period.
Wow. So with the hereditary aspect, means that basically there's nothing, those people who are born when their parents have depression, is there something they can do to manage the disease?
It all depends on your environment. So if you get a lot of stresses and you get a lot of other things, it's not just depression. It's not just about hereditary. The hereditary portion plays just a little role, like 20%. Okay, but it's mostly about, there are a lot of hormones in our body. There's a hormone that's called serotonin, the feel good hormone. In depression it's low. And then there are other mental health conditions that also affect the level of hormones in our bodies that predispose you to getting depression. And also some things like alcohol use, cocaine, cannabis can all predispose you to getting depression, because they alter the hormones in your body. And then you may get depressed from it. Someone can get depressed because they're tired of being a failure, because they're alcoholics, people are, so it's all linked in a way.
So is depression treatable? Can you treat it?
Yes, it's very treatable. When you come to the hospital and we say you are mildly depressed, we may not necessarily start giving you medications. You may benefit from therapy. We will help you to identify those things that are causing the stress, identify those things that are causing you to be depressed, and then we'll give you ways of counteracting it. So there's therapy for it. It could be that it's from your family environment is not good. We can do family therapy for you to work around those things. But then if still you're not getting better, then we can switch to medications.
I think I heard of antidepressants.
Yes, antidepressants. So there are several antidepressants, and these antidepressants, as I was saying earlier, because they are hormones and neurochemicals causing depression, the lack or the excess of them is causing this. So the antidepressants actually kind of levels it out. Those that are supposed to stay longer in the blood will help it. Some antidepressants help you to stay longer, others make you feel better about yourself and all.
I think the main problem with mental health issues is that many people feel that when they start a treatment for it doesn't look like there's an end in sight. Like for example, somebody gets malaria, he or she knows that if he takes malaria drug, he will get better. But for mental health issues, it looks as if there's no end to the treatment. Why is it so?
Well, for something like depression, we can treat you up to 6 months when there are no symptoms. Sometimes it's so bad that I have a couple of clients who it's so bad that we have to actually do ECT for them, or electroconvulsive therapy. That's like will induce seizures that will help with the depression. Yeah, because it's coming into their mind like, I'm sad, I want to kill myself, I want to take my own life, so let me do it. So then we have to step in.
When it gets to mental health issues, especially in Ghana, it looks as if when you compare to other diseases, with other diseases like malaria, when you're sick, you go to the hospital, they give you some drugs, that's accra, if not severe malaria, accra, 3-4 days, you start feeling well. But when it comes to mental health issues, it looks as if it takes a longer time for the people to recover. Some people don't even totally recover. So my question is that, why is it so? How long does somebody actually recover fully from depression?
Yes, there are people who can recover fully from depression. So about 1/3 of our patients will recover fully and not need medications again. 1/3 may recover and may relapse maybe later on in life. Another 1/3 may go on to actually commit suicide or end their own lives. So it's important that you get treatment, appropriate treatment early. so that we start balancing out the chemicals in your body, doing the therapy that you need. By 18, by 1.5 years to 2 years, you should be totally off. Depending on how you respond and how you are compliant to the medications, you are applying the therapy, the skills that you are being taught at therapy and all. So people do recover fully. I have clients who have recovered fully.
Oh, that's
who
amazing.
Do not need to come back to the hospital.
Oh, okay. So now let's talk about the money aspect.
Okay.
How much does it cost to get treatment? If somebody has depression or any mental health issue, where do they go to for help? How much does it cost at where you are?
Okay, so it's very, very important to come to the hospital, because when you come, we will go through maybe some questionnaires or ask you questions. We will determine whether you are severely depressed, moderately depressed, or mildly depressed. And then knowing that will help us to guide our treatment. So we know that, okay, so if you are mildly depressed, you would not probably need medications. You may just need some therapy, then you'll be fine. And therapy is about 20 cedis per session.
Oh, okay.
Consultation is about 20 cedis. That's like $3.8. Very affordable.
That's cheap.
Yeah. And then also, if you are severely or moderately depressed, we can give you some medications. And the medications, some of them are covered by insurance, some of them too are not so, it's not so expensive. So it's important for you to come. When you come, we start treatment, then we'll be monitoring how you are doing. Some may go to mild, then we may start reducing the dosage of the medication and finally take you off the medication totally. So it's important for you to come, because sometimes people who are depressed have sleeping issues. So if you can't sleep well, your chemicals in your body, your hormones become furthermore imbalanced.
Wow.
Confounding it. So when you come, you know that, okay, we'll add some things to help you sleep. We'll help something to help you with the mood, and then it gets better. So you always get better when you come to the hospital. The first point of call is come to us. There's no shame in coming. It's important. Save your own life. Come and see us.
So then if when we were talking, I was wondering that because even for adults, even when somebody is even old, maybe even the person is in their 40s, it's still not, you still don't know yourself that well. So I was just wondering, have there been cases where you found that even children have depression?
Yes.
Wow.
Yes, some children do have depression, but then they may not overtly show symptoms like adults do. A child may not attempt to take their own life, but we've had some teenagers actually succeeding in taking their own lives.
Wow.
In schools, in secondary schools recently, we've had some schools, they've killed themselves just because they were so sad. We have cases in the university who have killed themselves. So the signs are always there. The person may become withdrawn. The person may even become what we call stubborn. They may try to rebel. It may show some sort of, that's how they are expressing themselves, just maybe to get attention from the parents or from school and all. So it's important for us for parents to actually notice changes in the child's behavior. The child may be sleeping too much in school. The performance in school may be dropping. Maybe this child always is first, second in class, and all of a sudden the child is 10th. Maybe they are bullying this child in school, causing the child to be depressed, or even sexually being abused, emotionally being abused. So it's a really, really a wide range of symptoms that children may show, and it may not specifically fall into the adult category, but as parents we should actually look out for our child. And when you see that there are any changes in your child, we should try and talk to them and find out what is happening. Sometimes they may just need a change of environment. They may just need you to listen to them more, or find out the root cause, what is happening. It's important.
Wow. So, and I just want you to say something. We're about to end the interview. So I want you to say something to viewers. Anybody who thinks that he or she is suffering mental illness, what can the person do? Or what should the person do?
If you think you have a mental illness, there is no shame in admitting it. because then you'll be actually saving your own life. And if you notice that your friend or your loved one has a mental illness, it's how we talk to them. It's how we encourage them. We should actually try and come to the hospital as soon as possible, because more often than not, is there a lot of neurochemical changes that is happening in their body, and they will need medications, they may need support, they may need therapy. So please come to the hospital. It's very, very important that you come and see us in the hospital, so that we give you the needed help that will help save your own life. And there is no shame. 1 out of 5 Ghanaians have a mental health issue, so there's no shame in actually coming and seeking for help.
Okay.
Yeah.
1 out of 5 Ghanaians.
Yes.
Wow, that's a lot of people.
Yeah.
That's a lot of
Yes.
people. Because if our population is like I think 30 million, that's a lot.
Yes. So you may be thinking, so we know, because we are always looking at just depression, we are always looking at just one schizophrenia. You may think the people who roam around the streets are the ones who are mentally ill, but then there are people who have anxiety. You are anxious. People have social phobias. When they go to crowds, they can't talk. They can't open their mouth. There are people who are scared of ants. There are people who are scared of cockroaches. We have agoraphobias. People who are scared of small spaces. Those are all some sort of mental illness. So then yours may not be overt. Yours may be very minimal. But then 1 out of 5 have a mental illness.
That sounds scary.
Oh, it's so scary. I mean, it's all because the human brain is complex, and environmental changes, genetic conditions and all. So really, the most important thing is we are fine, and for us to all be fine, we should seek the help early.
So does your hospital have a service like a screening kind of thing? Because I know that let's say if you want to check your eyes, you can go for an eye screening.
Okay.
Is there anything like a mental health screening? I think there's something like that.
Not overtly so, because the conditions are so many. We can't screen for like everything. But then we have open arms to take in everyone who wants to just talk to us, and maybe you have some fears, you have some anxiety issues, you have some things you want to talk to us about. There are lines that you can always call.
Oh, okay.
That you can get someone to talk to and then see you.
Okay.
And also, if you think you can't come to the hospital does have home services.
Well, that's great.
Yeah, that we can actually come home, come and see you, offer you the help that you need, and then yes, we just want you to be fine. So it's important that you come to the hospital.
Okay.
And if you can't come, call us and let us come to you.
Okay. So we'll put the numbers in the description so that you can call them. Okay. What time does the hospital open, and what time do you
close? It's 24 hours.
Okay.
It's open 24 hours. So you can come to the hospital at any time.
You meet a doctor anytime.
You meet a doctor at any time.
Oh, that's great.
Yeah, it's 24 hours.
So where is the hospital located?
We are at Asylum Down, Accra Psychiatric Hospital. It's opposite Adabraka Polyclinic.
Oh, okay, that's fine.
Okay, very close to Rich Hospital.
Okay, I've seen the place.
Okay.
So, guys, this is the mental health. If you are suffering from depression, if you think you are suffering from depression, or if you know anybody who is suffering from depression, don't take it lightly. It's a very serious issue, and it can be solved. I mean, we don't want to hear any gone too soon from a very curable problem. I mean, you wouldn't want your relative to die from malaria. It's the same thing with a mental health issue. Don't take it lightly. If you have any problem, just visit the Accra Psychiatric Hospital. You can go and see Dr. Boateng there. She'll take good care of you, or any other qualified doctors that are there. So don't forget to smash the like button. Thank you for watching, and see you next time.